For additional signees past the hour, we will begin the webinar in a few minutes. Good afternoon. Thank you for joining today's 2021 Connect and Protect Law Enforcement Behavioral Health Response to Solicitation webinar. Today's webinar is focused on the Connect and Protect Law Enforcement Behavioral Health Solicitation. I'm Demetrius Thomas, Deputy Program Director at the Council of State Government's Justice Center. I will be moderating today's webinar, which is funded by the U.S. Department of Justice Bureau of Justice Assistance, what we commonly refer to as BJA. To give you an overview of today's webinar, first I will introduce the speakers. Then there will be an overview of the Justice and Mental Health Collaboration Program, or Gmhcp. After that, we will discuss the award information, budget, application criteria, followed by the submission requirements. Finally, toward the end of the webinar, we'll have time for questions and answers. Anytime during the webinar, you can ask a question by typing it into the Q&A panel or the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to go through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx technical support at 1-866-229-3239. Please understand that there are some technical issues that we may not be able to resolve. We are recording the webinar and will post it on our website by the end of the week. Next slide. Perfect. Eric Dietrich is a division chief in the BJA Programs Office, supervising a team of state policy advisors who administer the BJA Adult Drug Court, Veterans Treatment Court, Justice Mental Health Collaboration Program, and upholding the rule of law and preventing wrongful conviction discretionary grant programs, as well as the Justice Assistant Grant and Coronavirus Emergency Supplemental Funding formula programs in 10 states. Prior to his promotion in 2016, Eric served as a state policy advisor in BJA, managing a portfolio of justice and information sharing and law enforcement focused training and technical assistance cooperative agreements. Before coming to BJA in 2013, Eric had over 6 years of experience in developing federal grant proposals, including 2 successful Gmhcp applications. Maria Fryer is the Justice Systems and Mental Health Policy Advisor within the Bureau of Justice Assistance for the U.S. Department of Justice. She oversees the Justice and Mental Health portfolio and collaborates with the Council of State Governments Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the need of municipalities and the citizens they serve. Maria previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Fryer has worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for repeat offenders and drug addictions. She also served as the United States Army as a member of the Military Police Corps. Samuel Level is also a state policy advisor within the Bureau of Justice Assistance within the Department of Justice, where she manages the Justice and Mental Health Collaboration Program. Prior to joining BJA, Tammy worked as the law enforcement lead for Maryland State Administrative Agency and the Governor's Office of Crime Prevention, Youth, and Victim Services. I am Demetrius Thomas, Deputy Program Manager within the Council of State Government's Justice Center Behavioral Health Division, and I oversee the Justice and Mental Health Collaboration Program, technical training, and assistant grantees. Prior to joining the Justice Center, I worked at the New York City Department of Health and Mental Hygiene, where I led the agency's work at the intersection of criminal justice, mental, and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis teams. Next, we'll provide overviews of the mission of the Bureau of Justice Assistance, or BJA, as we like to say, the Council of State Governments Justice Center, and the Justice and Mental Health Collaboration Program. BJA's mission is to make communities safer by strengthening the nation's criminal justice system. It grants training and technical assistance and policy development services, provides state, local, and indigenous nations with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, support law enforcement, and combat victimization. The Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all 3 branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Today's webinar is part of the Justice and Mental Health Collaboration Program, Gmhcp, Training and Technical Assistance, TTA, which many of you may already be familiar with if you currently have or have had a Gmhcp TTA grant. The Gmhcp TTA promotes innovative cross-systems collaboration and provides grants directly to states, local government, and federally recognized indigenous nations to approve responses for people with mental illness and substance use disorder who are involved in the criminal justice system. Thanks everyone for joining the webinar. I'll be back later to discuss the application criteria, submission requests, and moderate the question and answer portion of the webinar. Now I'm going to turn it over to Maria, who will discuss the award information. Maria?
Great. Thank you very much, Demetrius. I would just like to speak about the eligibility, and then we'll move on from there. Eligible applicants for this grant are state, unit of local governments, Indian tribes, which are federally recognized by the Secretary of the Interior, and tribal organizations. To the extent your collaboration project's mental health agency or criminal justice agency meets one of these eligibility categories, it can be the project applicant. A mental health agency is an agency of the state or local government or its contracted agency that is responsible for mental health services or co-occurring mental health and substance abuse services. A substance abuse agency is considered an eligible applicant if that agency provides services to people with co-occurring mental illness and substance addiction, or as we like to call it, CMISA. Just need one more acronym. A criminal or juvenile justice agency is an agency of state or local government or its contracted agency that is responsible for detection, arrest, enforcement, prosecution, defense, adjudication, incarceration, probation, or parole relating to the violation of criminal laws of that state or local government. Next slide. I want to highlight an important point because Gmhcp aims to promote cross-system collaboration. We will only consider applications that are jointly administered by a criminal justice agency and a mental health agency. However, under this solicitation, only one application by any particular applicant will be considered. The other agency or agencies must be proposed as subrecipients or subgrantees. Again, the lead agency must be a state, unit of local government, Indian tribe, federally recognized by the Secretary of the Interior, and tribal organizations. If you're a mental health or criminal justice agency that meets these criteria, then you are eligible to apply as a lead applicant. If not, then, for example, the state or unit of local government will need to be the lead applicant, and another partner in the program would be considered the subrecipient. Next slide. The focus of Gmhcp is to promote collaborative responses that improve outcomes for people with mental illnesses and co-occurring substance abuse who come in contact with the justice system. These cross-system collaborations between criminal justice and mental health agencies can not only improve outcomes for the individual, but can also promote positive public safety and public health outcomes for the community. The term preliminarily qualified offender means an adult or juvenile accused of an offense, diagnosed, or shows obvious signs of mental illness or co-occurring mental illness and substance use disorders. During arrest or confinement or before any court, they must be unanimously approved for participation by court officials and to not pose a risk of violence to any person in the program or the public. If selected to participate in the program, they cannot be charged or convicted of any sex offense or any offense related to sexual exploitation of children or murder or assault with the intent to commit murder. Next slide. So a little bit about grant goals. Gmhcp supports a wide range of cross-system improvements. This includes, but not limited to, specialized training for public safety officers and mental health agencies, increased intergovernmental cooperation between state and local governments, and more cooperative efforts between public safety officials and mental health agencies, particularly at the earliest intercepts in the criminal justice system, all to address the needs of individuals with MI, mental illness, or CMISA. For those of you who may not know or would like to recall the sequential intercept model, we have included a link. I think someone's going to put that up in the chat for us. Next slide. This year, the Connect and Protect solicitation is particularly focused on seeking applications that address one or more of the following objectives: to design and adopt best practices in crisis response to assist law enforcement officers during encounters with people with MI or CMISA, plan and deliver a law enforcement agency response program in coordination with a mental health agency, advocacy, and services to improve and enhance the response. Pay salaries as well as other expenses such as training, overtime, and coordination activities to design and implement a police mental health collaboration. Examples of police mental health collaboration or PMHC response models include such models as embedded clinicians, social workers and law enforcement agencies, co-response teams, crisis response teams, mobile crisis outreach teams, intensive case management teams, and law enforcement mental health integrated 911 dispatch. It can also pay to conduct an evaluation of the PMHC in community and as well as community satisfaction, engage citizens through officer outreach and education to improve public safety. Next slide. To continue with objectives, it can also build positive community relations and trust through public communication strategies, enhance officer knowledge and skills in responding to community members with MI or CMISA, and increase public safety agency capacity to develop and sustain programs by collecting data to inform practices, stakeholder groups, policy development, and ongoing professional development. Next slide, please. So next, we're going to talk a little bit about a resource known as the Police Mental Health Collaboration Framework Document, or it actually outlines outcome measures, which are incredibly important regardless of what model you decide to take up. Outcome measures would be the same for any one of the models that I just described, and these can be such things as increased connections to resources, reduced repeat encounters with law enforcement, minimized arrest, and reduced incidents of use of force. Along with these are 6 questions. They are a part of the Police Mental Health Collaboration or PMHC self-assessment tool. The tool helps law enforcement agencies and their behavioral health partners assess their progress toward implementing high-quality, partnership-based interventions. It is designed to provide resources to help improve responses to calls for service for people with mental illness or co-occurring substance use condition. These questions are used to assess the status of current response efforts. Responses will generate a unique action plan that directs responses to help strengthen initiatives. And all these questions are based on the Police Mental Health Collaboration Framework Document, which also talks about the outcome measures. We encourage you to learn more about PMHC at the link made available here. I think someone's going to put that up for us. And for law enforcement agencies to complete the tool. Next slide. So a little bit on deliverables. For applicants who are awarded the Connect and Protect Award, there are a few deliverables that all awardees must complete. First, there's a 2-phase process consisting of first planning and second implementation. For phase 1, the planning phase, the grant recipients will receive intensive training and technical assistance, otherwise known as TTA, from the Council of State Governments Justice Center. And under this phase, grantees will follow and document the Planning and Implementation Guide. This document is refined each year to meet the needs of grantees. As outlined in the solicitation, for up to 12 months after receiving final approval of the project's budget from OJP, grantees can spend up to $100,000 during the planning phase to work with the Justice Center on the Planning and Implementation Guide. Past grantees have found that planning phase helps prioritize where to begin in the implementation process. The second phase, known as the implementation process or phase, is where grantees begin, and it's after BJA approves the guide. Grantees can then spend the remaining grant funds on directly related implementation activities. Next slide. So a little bit more about deliverables. Grantees or awardees can also develop a coordinated and documented approach to implementing or enhancing law enforcement behavioral health responses for individuals with MI or CMISA who are involved with the criminal justice system. Also, engage in regular training and technical assistance activities with the Justice Center during both the planning and implementation phases of the program. And this is an expectation of all grantees that you actively engage in training and technical assistance. Next slide. And a little bit more on deliverables. Outline sustainability plans for the program after BJA funding has concluded. And now on to program-specific priority areas. The Office of Justice Programs, of which the Bureau of Justice Assistance is a part, weighs many factors when making funding decisions. This includes, but is not limited to, giving priority consideration to applications that meet the following criteria. Promote effective strategies by law enforcement to identify and reduce the risk of harm to individuals with MI or CMISA and to public safety. To also promote effective strategies for identification and treatment of women accused of crimes who may have MI or CMISA. Also to propose interventions that have shown by empirical evidence to reduce recidivism. And then also, when appropriate, to use validated assessment tools to target people with a moderate or high risk of recidivism and a need for treatment services. Next slide. So what priority areas? Also, to demonstrate and ensure that funds are used for public health and public safety, demonstrate active participation of co-applicants in administering the project, to document in whole or in part that funds used for treatment of incarcerated populations will provide transition and re-entry services for such individuals. Next slide, please. Applicant requirements. So I just want to emphasize to also include detailed activities for both the planning and an implementation phase, to also include at least one criminal justice agency and one mental health agency that will work together to implement the program with roles and responsibilities clearly delineated in an attached MOU. And this is a requirement and is part of the basic minimum requirements for this grant. Again, just to reiterate on the next slide, awards, amounts, and durations. There is an anticipated total of 36 awards, with each awardee receiving $550,000 for an anticipated 36-month project, which is a 3-year project, which is expected to begin on October 1, 2021. We're very hopeful with that. Okay, well, thanks everyone for listening so intently. I'm going to now turn it over to my colleague, Tammy, who's going to discuss the budget requirements. All yours, Tammy.
Thank you, Maria.
You're
Next
welcome.
slide, please. Just a little bit more information about the budget. The budget should be complete, cost-effective, and allowable. All costs should be reasonable, allocable, and necessary for project activities. Please remember that only $100,000 of the funds will be available to complete the planning phase in the first 12 months of the project. The budget should clearly indicate the cost for the planning phase. Additionally, there are several costs that are not allowable under the Gmhcp funding. This includes construction, prizes, rewards, entertainment, trinkets, and any other monetary incentives, client stipends, gift cards, vehicle purchases, and food and beverage are all considered unallowable expenses. Next slide. The Gmhcp authorizing legislation also requires a non-federal match of 20% of the total project cost in project years 1 and 2, and a 40% match of the total project costs in project year 3. Cash or in kind, which is the third party, match are both allowed. Match costs in the budget must meet the same guidelines as the federal costs for being allowable, reasonable, allocable, and necessary for the project. It's recommended that you do not include an excessive amount of match over the minimum requirements in the application budget. Next slide, please. For clarification between the difference between subawards versus procurement contracts. Please carefully review the OJP Grant Application Resource Guide, which is linked directly in the solicitation subsection titled Information on Proposed Subawards, if you have any planned, and Proposed Procurement Contracts, again, if you have any planned, and the resources linked therein to ensure that you properly categorize your cost in these sections. There are different administrative requirements related for each. For example, a procurement contract requires full and open competition, while a subaward does not. Next slide, please. With this, I'm going to go ahead and turn it back over to my colleague, Demetrius.
To peer review and receive consideration for funding. We've also included where each document should be completed and submitted. As well as all of the information listed here. Please note that applicants are not required to submit performance data with the application. Rather, performance measures information is included as an alert that successful applicants must be required to submit performance data as a part of the reporting requirements under the award. Also, an applicant that proposes to use award funds to conduct project evaluations must follow guidance under Note on Project Evaluations under the OJP Grant Application Resource Guide. Applications that meet the basic minimum requirements will be reviewed by peer reviewers. Applications will be evaluated on how the proposed project program address the following criteria on each criteria is weighed as 15% for the statement of the problem, description of the issue, 40% for the project design and implementation, 30% for the capabilities and capacities, 5% for the data collection and performance measures plan, and finally, 10% for the budget. I will now briefly highlight the submission requirements. New this year, applications must be submitted to DOJ in a two-step process. Step 1 is that applicants must submit a SF-424 and a SFLL in grants.gov by 11:59 p.m. Eastern Standard Time on July 6th at the reference linked. Please note, to register in grants.gov, applicants will need to obtain a Data Universal Numbering System, DUNS, and a System for Award Management, SAM, registration or renewal. For step 2, applicants must submit the full application, including attachments by 11:59 p.m. Eastern Time on July 20th at the reference link. All application questions should be directed to the National Criminal Justice Reference Service Response Center at grants@ncjrs.gov or by phone at 1-800-851-3420. All applicants are encouraged to review the How to Apply section in the OJP Grant Application Resource Guide. OJP urges applicants to submit applications at least 72 hours prior to the application due date to allow for the application to receive validation messages or rejection notifications from grants.gov and to correct in a timely fashion any problems that may have caused a rejection notification. The next 3 slides highlight tips to prevent issues. 1, remember there is a new 2-step process this year. Be clear on the deadline for each process and reference the How to Apply section of the OJP Grant Application Resource Guide. 2, make sure the correct DUNS number is entered in the SF-424 and that it is registered in SAM. This specific agency registered under the DUNS number in the SAM will be responsible for submitting the full application in Just Grants and administering the award if it is funded. 3, the federal request amount entered in the SF 424 should match the total federal request in your application budget for the entire grant period. 4, do not include any of the prohibited costs listed on page 8 of the solicitation. 5, there is a new requirement to attach the MOU between the Criminal Justice Agency and the Mental Health Agency partnering on the award. Please note that while the MOU must be attached, it does not have to be executed at the time of submission. However, if the grant is awarded, non-executed MOUs could impact access to funding. 6, all applicants must complete the disclosure of duplication and cost items in just grants. 7, if funding is being used to pay an outside evaluator or researcher, then applicants must complete the research and an evaluation independence and integrity attachment. Again, see the OJP Grant Application Resource Guide for further instructions. Finally, we encourage you all to make use of the application checklist to ensure that you have completed all the necessary components for the application. Now we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can chat in your questions in the Q&A box at the bottom right-hand corner of your screens. We will take as many questions as possible. As we are taking these questions, we will advance the remainder of our slides, which have information on the presenter contact information and CSG Justice Center newsletter sign up. Okay, we have one question now. Maria, I'm going to direct this question to you. The application or the solicitation document says public institutions of higher learning as eligible applicants, but that was not included on the webinar slides. Has that changed?
No, that's accurate. Institutions of higher education can apply, but again, it goes back to that eligibility criteria of state or local government or federally recognized tribe. Oftentimes, universities that apply are state universities. That answered the question.
Perfect. I'm going to direct this question to either Eric or Tammy. Does an in-kind match have to be from a third party, or can the in-kind match be from the lead agency?
Yeah, I answered this in the chat, but
Okay.
Cash match means funds that are contributions that are coming from the lead agency out of their own budget. So that would be considered a cash match, no matter what the cost is, including personnel. In-kind match means contributions coming from a third party, where you're estimating the value of that, whether it's time or volunteers from a third party, and not coming from the lead agency. But personnel costs contributed to the project certainly are an eligible match.
Okay, I'm going to direct this next question. I don't know if it's been answered in the Slack. If it has, you all let me know. Is there a place where you can see a list of or summaries of any grant activities, any summaries of any past grantees projects? For example, have there been any grantees in Kansas in the past? Maria, do you want to answer that question?
Sure. Yes, there have been grantees in Kansas. There's been grantees in all 49 states, except I believe for South Dakota. So Gmhcp is far and wide at this point. I think the best place to find descriptions, there is a list on, I want to say OJP's website, where all the funded projects are listed. I have to find that link for you and get back to you, and maybe pass it through CSG following the webinar, but I believe there is brief descriptions.
Thanks, Maria. The next question that we have is, are applicants able to apply for both the main Gmhcp grant due that was due on July 6th and the Connect and Protect grant due July 20th? Maria, I'll kick that question to you as well.
Sure, yes. Because they are two different solicitations, two different types of projects, as long as the projects are different, then yes, you can apply for both.
All right, I don't know if we had any other questions. I think we've addressed all the questions that I've seen. Are there any other questions that participants have? Okay, just got another question. Isn't it, Maria, this seems like this may be a question for you. Is it allowable for a local nonprofit organization to be the organization that carries out the functions of grant activities under the local government agency, with the lead agency being the city police department and the mental health agency being the local community service board? The nonprofit would work to facilitate the planning and implementations of services. Is this allowable?
Yes, certainly. And we see this quite often. So there's the applicant organization and there's the implementing organization. And the applicant organization, that goes right back to that eligibility criteria that we mentioned several times. But under that applicant organization, they can have subgrantees and other types of partners. So most certainly they can be part of that project as an implementing agency, yes.
Thanks, Maria. Tammy, I'm going to kick this next question to you. Are vehicle costs, excluding vehicle purchases, allowable, and in addition, mileage lease charges?
I'm sorry, can you repeat the first part of that, Demetrius?
Sure. Are vehicle costs, excluding actual vehicle purchase, allowable? This also includes mileage and lease charges.
Yes, they would, but not the vehicles themselves.
Perfect. I believe this is another budget question. So the 100K for planning, but the rest of the amount possible up to 550K, but is there a cap per year? I'm going to kick that question to you, Eric. The question is, they understand, I guess the person asking the question understands that the 100K is for planning, and anything that remaining goes toward the 550, but they want to know if in between the implementation years, there's a cap on the amount of money that's spent between those years.
No, there's no cap on a year for implementation. I would just keep in mind the max requirement is tiered. So in year 2, it's going to be 20%, but in year 3, it goes up to 40%. So that's just something to keep in mind. But there's no cap on the federal expenditures per year.
Perfect. Thanks, Eric. Tammy, I'm going to kick this question to you. How can someone access the SF-424 and SFLL forms?
Well, I'm going to start with the SFLL form. That's the disclosure of lobbying activities. That's an attachment, and there is a link for that in the solicitation. And Eric, I might defer to you for the 424. It's a little bit different this year because we have a new system in Just Grants. Previously, it was automatically on the face page of the application. That was technically the 424. Is that still the case with Just Grants, Eric?
Actually, with this year, there's a 2-step process. So the first step is to submit the SF-424 and the lobbying disclosure form, and that will be built into the application in grants.gov. And then after that has been successfully submitted, then the application will transfer to Just Grants, and then you will complete the remainder of the forms. But the SF-424 and the SFLL, or lobbying disclosure form, are filled out in grants.gov.
Thanks, Eric. Another question, I'm going to kick this question to you, Maria. Can a county entity collab with MHU for grant? I guess that's a mental health unit for grant. And if so, is there still a requirement for an MOU between law enforcement and mental health entities?
So collaboration between a county government, which would be eligible under local government, and a mental health authority. Yes, this is a collaborative project. So that, yes, and an MOU is required. Did I get the whole question, Demetrius?
Yeah. So basically, it would be, is the MOU still required between the law enforcement and mental health entity? And the answer is yes. The MOU will still be required because this is a collaborative grant.
Yes, and also just want to remind the audience also that the MOU is a basic minimum requirement. So there are folks that BJA contracts with to actually, they will screen you out if that attachment is not there. So you want to make sure that you do have an MOU in your application packet in order for it to be complete. Just want to make sure I put that out.
Okay. And I want to just follow up on that question, Maria. Someone says you mentioned the MOU does not have to be fully executed for the application attachment. Do you know if the same is true for the main Gmhcp? Helpful because, and I think they're definitely referring to the Gmhcp solicitation. Helpful because the process is lengthy. We execute it after the award. So they're specifically referring to the Gmhcp application solicitation.
Right. So BJA recognizes that it can be a lengthy process, and oftentimes, it has to be calendared at the county level, and it can be a cumbersome process to get an MOU, fully executed and with signatures. So, what we want to see is that there is partnership between the justice agency and the mental health authority, and that it's thoughtful, and that it's documented. And if it's not fully executed, it still constitutes, an application, a completed application for this project. And it does apply to Gmhcp, that, the previous webinar that we had, and in the other solicitation, because both of these solicitations are actually Gmhcp funding, and they do follow the same rules. So we do recognize that, and I just want to say that yes, it is required, and I hope that clarifies.
I think it does. Thank you, Maria. Eric, I'm going to ask this question for you. Do you have to spend the exact 100K for the planning year, or can you spend less?
The way it's going to work is that we ask you to budget $100,000 for the planning, and you will, if you receive an award, you will only have access to $100,000 for completion of the planning phase. But if you end up completing the planning phase and BJA approves it earlier than that, and you have spent less funds than that, then you can certainly revise your budget to include any remainder into the implementation, again, with BJA approval. But when you submit your application, you should have $100,000 in for the planning cost, because that's the only amount that's going to be available up front.
Got it. Thanks, Eric. Maria, you answered this question before, but just for clarification purpose, could you answer again? Are public colleges eligible to be lead applicants?
Again, I would just point to the eligibility of this program, as well as Gmhcp, states, units of local government, and federally recognized tribes. So if the college is a state public college or university, yes, then it is eligible to apply.
Thank you, Maria. I think this is another question for you. Is there a minimum length for the planning phase, Maria?
We leave it up to 12 months or up to a year. It, to Eric's point, it doesn't always take that long for each community, and we'll work with you individually. If you do finish up the planning phase early and BJA does approve your planning and implementation guide, but we wanted to allow really the maximum amount of time for planning, because these can be very complex programs, and we want you to have a really solid roadmap, even though you've already visualized your program and you've written about it in your narrative. By the time it's awarded and you actually get rolling and people are in place and you start receiving training and technical assistance, you might discover maybe a better way to do something. You might go back to the drawing board and you still have those goals and objectives, but you might change things up a little bit and find more sort of better way, I guess, to do things. And we want to allow enough time for that planning phase, because once you get rolling in implementation, then you just sort of, that part becomes, I won't say easy, but it does move along very smoothly if the planning is up front.
Thanks, Maria. Eric, I'm going to kick this question to you. It convolutes certain things, but I'm sure you can untangle it. The planning and implementation, and does the 100,000 mean we only have 100K for the first year? So I think they're conflating, they're automatically assuming that their planning phase is going to take a full year, and they want to know whether they only have the 100K for that year. And so that's the first thing, and just making sure that they're clear that the planning and implementation are two different phases. The planning is one phase, the implementation is another, but just to be clear for them on if they take the first year, a full year for the planning, is the 100K all that they have?
Yes, the way that it would work is that if somebody's issued an award, they're only going to have access to $100,000 of that award. And then once they're done with the planning phase, like Maria said, that could take the full 12 months. Potentially it could be done sooner. Once BJA approves the planning phase and says you're ready to move on to implementation, then we will release the remainder of the funds for the total award amount, and that can be used for the implementation.
Thank you, Eric. Maria, I'm going to ask this question to you. Can we submit letters of support as appropriate in addition to the MOU from other agencies?
Sure. If you think that will strengthen your application, then sure. I think it's great to show partnership and to document partnership, and in any way that you can do that, and a letter of support can certainly do that.
So I'm going to paste it, Maria, but this kind of sort of falls. We have a series of questions that fall under MOU. So the second one is, we have three. So the second one is there somewhere I can find sample MOUs or templates?
Yes, I'm not sure where on BJA's website, but I know that they're out there, and I know I've provided them in the past. There's some basic elements to an MOU. I would say, potentially look to other folks in your county or in your state and ask for examples. It really talks about the roles and responsibilities of each partnering agency and the expectation to reach the goals of the program. It talks about typically who's involved and a few basic things like that. They can be more complicated or less complicated, but they don't really need to be complicated at all. And I would just seek out any example that you think really fits what you're trying to do.
Thank you, Maria. And then the third and final MOU question from this series. If a law enforcement agency is collaborating with two mental health providers, each with specific population focus, are MOUs needed for both mental health agencies? I'm going to stop there. There's another part, but I'll stop there.
Sure. So it kind of sounds like it's not all one project. If you were all one project, you could be on one MOU. If two mental health agencies, perhaps, and it took care of different regions, different geographic regions, but you're both partnering with the same one criminal justice entity, you could be on the same MOU. I would say don't make it really difficult if you don't need to, but otherwise, if you really feel like you have to have two separate, it really depends on what you're trying to do. But it's not necessary if the lead applicant is working with both mental health entities.
Great. And then another question that we have, this is pretty straightforward, Maria. If clinical staff are already embedded in a law enforcement, could this grant be used to enhance, supplement those existing services?
Certainly. That sounds like a great project. If you've got clinicians already embedded in your law enforcement agency, that's a pretty sweet situation. And if those clinicians can continue to grow and enhance partnership with additional services, which they typically can, because they're networked in with those other service providers, then that's a wonderful thing. I would encourage as well that if you're going to do that, that you still need an MOU, of course, with those additional service providers. But yes, a clinician can definitely help bridge the gap with additional services.
Thanks, Maria. And this is a sustainability question, Maria. I'm just going to ask you a simple question, though. After the 36 months, will there be funding opportunities for to sustain the program, or will all sustainability funds be expected to come from other funding sources?
So this is a tough one, and this is where your program right from the outset, and I would encourage you to build this into your planning. When we talk about planning in those first 12 months, what it is that you're going to do, or what types of information you're going to collect up front to show impact of your project. You want to be able to show what worked well and what didn't work well, how you were able to take information along the way and pivot to continue to show positive impact. This is going to be critical for your sustainability plan. And so I would encourage you to really think about that, how you're going to show that you improved the situation for people with mental illness, for the officers, for the community, and put that into your planning part of the project, because sustainability isn't going to be reliant on, on federal funding. It's going to be something that a plan where you can demonstrate to the state, that you can demonstrate to the county, or to other types of funders that are maybe private perhaps, and show impact and show that you're really serious about making a difference, and you have qualitative data to show that impact. You have quantitative data in terms of numbers. You're able to show a reduction in recidivism, that the same people aren't cycling through and coming back to the criminal justice system over and over again, because you have strong partnerships and people are being connected to services, and you're helping to build capacity in the community as a partnership and a collaborative program. So I would just encourage you to really think about your sustainability plan in those first 12 months and engage in TTA. They are the experts to help you to do that. So really, that's where we're giving you the tools, and it's up to you to really take advantage of them.
Thanks. Thanks, Maria. Eric or Tammy, I'm going to kick this question to you, and it's really for a person who's new at applying. Their question was, is there help with all of this? I am new to the grant funding. I'm on a grant that is ending in September. So is there any advice or guidance that either you, Tammy, or Eric could give someone on pursuing the funding solicitation?
One of the things I would recommend definitely is to carefully read the guidelines in the solicitation. Everything is outlined in there as to what is needed in the application with regards to not only the different attachments, but the narrative section of the application. Just follow the guidelines of the solicitation and you should be okay. And if you have any questions, please feel free to reach out.
Wonderful. Eric, is there anything that you would add?
No, I think that is definitely the most important part. What Tammy just said is read and read and read and use that checklist and make sure you're following all the instructions to a T. The one part I would emphasize also is making sure, obviously, that you are set up in grants.gov so you can submit that application, making sure that your DUNS number is registered in SAM, which is required for us to issue an award, and in doing those steps as early as possible as you can so that you're ready to submit the application. But what Tammy said is the best advice for any grant applicant.
Perfect. Thanks, Eric and Tammy. The next question, I can answer it since that is part of the Council of State Government's Justice Center forte. Does the TTA automatically contact to offer assistance with the planning implementation? And the answer to that is yes. If you are awarded the funding under this solicitation, we will, as part of the TTA of the Justice Center, we will reach out to you with everything that is needed to begin both and keep you on track for both your planning and your implementation phases of the grant. So we will be there from beginning to end of your three-year, 36-month duration for your grant, and we will contact you. Maria, we have two eligibility questions just in terms of what programs are eligible. The first is, can this be used to hold cross-discipline trainings about crisis response and appropriate crisis intervention?
So it's, Demetrius, I have one clarifying question. Is this about, can this take up a crisis intervention team model approach?
I would assume so. And if you are the person who wrote this question, please feel free to Slack. I think an additional question or confirmation, but I think the question is asking, under this solicitation, can the funds be used for crisis response trainings and crisis intervention trainings? I will assume that it will be linked for a continuation of crisis response models in the jurisdiction, I will assume. But the question just asked about crisis response and crisis intervention trainings.
Sure. So just the quick and short answer there is yes. So the funding can take up training. It's an allowable cost, and it could be training. You know, if you're thinking about expanding your crisis intervention team model, or if you just want to do crisis intervention and de-escalation training for a cross-system group of law enforcement and clinicians together, you want to get them in the room. Maybe you're still thinking about your model approach. Maybe it's a co-responder approach, or maybe it's a mobile crisis team, and you just want to do crisis, training. You can do that as well. We try to frame the different models in sort of buckets, and to just be able to identify sort of the approach that we're talking about. But truly, many police organizations and communities do a multi-layered sort of response. Sometimes they do a tailored approach. They actually, train in crisis intervention team. They do a traditional, 40-hour training, and then they layer on top other types. They layer on top 911 training. they layer on top other types of crisis response training. So, so training is an allowable cost, regardless of what model you take up. And regardless of what model you take up, you definitely want to go back to the framework and think about the outcome measures and how are you hitting those outcome measures when you're thinking about planning and data collection.
Thanks, Tammy. I want to be aware of everyone's time and recognize that it is now 5 o'clock, and we have 2 more quick slides that I want to go through. But because those slides are relatively quick, the final question about eligibility, Tammy, would a not-for-profit community mental health agency who already has a co-response model be eligible to apply, or would the law enforcement or paramedic agency be the lead for that if they wanted it to apply?
Maria, correct me if I'm wrong, but I believe that
I meant to say Maria, not Tammy. I'm sorry. That is the Maria question, Tammy. I did not mean to stick you with that question.
that's okay.
Well, Tammy was going to have it covered. I trust you would. But yeah, so you would need to have the government agency apply. It would be like under local government, county, state, city, municipality, to be the lead applicant. But the partnering agency can totally be the nonprofit. And if you're providing services and you're providing guidance, you know, you can provide lots of assistance because many law enforcement agencies are multitaskers and super busy, and I'm sure they appreciate your help. But the lead applicant has to be the local, the city or the county. Yeah.
Thanks, Tammy. And thank you, everyone. Thank you, panelists, for answering the questions, and thank you, participants, for asking such thorough, in-depth, pointed questions. I think it will make it easier for you to apply or respond to the solicitation. Moving forward with the PowerPoint presentation, on this slide, we provided the contact information of today's presenters. Please feel free to reach out to us if you have any follow-up questions. So if there were any questions that we weren't able to get to or that you have as you are answering and responding to the solicitation, please feel free to reach out to us. Next slide, please. And if you haven't done so already, we really encourage you to join the CSG Justice Center newsletter listserv. Not only is it a great way to learn about funding opportunities such as Gmhcp solicitation grants, but you will also receive information on upcoming trainings and resources from our agency and partners. I'd also like to take this time to remind everyone that this webinar has been recorded and will be posted along with this slide deck on the CSG Justice Center events website page by no later than the end of this week. Again, thank you all for joining this webinar. Thank you to all the panelists, and have a great day. Good luck with your solicitation responses, everyone. Take care.